Hey, it's Peter Morley, your patient advocate. I am here for my 34th trip to DC for patient advocacy, if you can believe it. I'm back with Senator Jeff Merkley, who I've not seen for 3.5 years. It's so good to be with you again, Senator. Thank you for everything that you do. I know that you have an act to end price gouging for medications. I would love to hear more about that.
Oh, absolutely. I tell you, I think every individual can relate to this in America because either the person is paying for drugs and paying outrageously high prices, or someone in their circle of family and friends is in that condition. We know we're getting ripped off. In my town halls in both blue counties and red counties, when people bring up health care and I ask people, how many people want to stop getting ripped off from the high price of drugs, like everybody raises their hand. And we pay so much more than people in other developed countries, in more than Canada, more than Japan, more than Australia, more than any European country, and yet we invest the most money in the research and development that goes into these drugs. So we should get the best price, not the worst. And it's good policy, it's good politics, it's just simply wrong. We can think this is a massive tax on America due to the greed of the pharmaceutical companies. We have to end it, and that's what my bill does.
So which is wonderful, because I hear a lot of people say that the cap on insulin was great, but it didn't go far enough. So I think this will help address some of those people that were, not included in that.
The Canadian doctors who invented insulin sold their patent to the government for $1 a piece so that everyone could have basically free insulin. That was 100 years ago.
Right.
And we are still getting ripped off on a massive level on insulin. This cap, by the way, lowers the price to the consumer, but it doesn't lower the price to the healthcare provider or to the US government. And so we are still paying as a country prices for insulin way above any other country. But it's a very good example of what prices should look like if we negotiated the price of drugs, or we use as a price index whatever the company has been willing to sell it to another developed country. And my bill basically says we will get the best price, not the worst. And the best price is the lowest price at which they sell to Canada, Australia, Japan, or any of 8 European countries. And so if people in Switzerland are getting the best price now, America will get that same best price. If it's people in Japan, we'll get that same best price. And I think that that is only right, given that we are massively subsidizing R&D for these drugs.
Well, I just want to say thank you so much, because I've testified, as you know, 3 times in the House, and the stories that I've shared, thousands of stories from Americans across the country, but the most heartbreaking stories to me are the people that have to choose between their life-saving medications and their groceries, and that should never be the case in the richest country in the world.
And that is the case for so many families every single